So, we'll have to go straight into this, I believe. Now, just a couple of points just from Hendricks, just to, while it's relevant, and the power of the integration of specific and general treatment. When I was a student, I lost the sight of my right eye, and Wernham took the treatment on. And the treatment of the eye was very, very specific and delicate. He worked on the lens, he worked on the vitreous humor, he worked on Schwann's, but he integrated it with the general treatment. So I'd have the body adjustment for all of the other aspects of it, twice a week, sometimes 3 times a week, and 2 to 3 times, in the beginning 4 times a day, he would do the specific work. And it's that integration of the general and the specific which is so important in osteopathy and what we call classical osteopathy. And it's very easy to get seduced into highly specific, technical, one-pointed technique, which has a very limited application. As Wernham used to say, after 6 treatments, people don't know what to do. And I never understood that phrase until I had a graduate in years ago. And she came to me and said, I don't know what to do next with the treatment. And they had no idea how to nudge the body along gently when there's no real symptomology to deal with at that point. But there's the principle. And the title of my talk, what I want to talk about, what I want to get across is this idea of fragmentation in osteopathy. We divide it up into all sorts of things. And what that leads to is what Littlejohn says here. Don't let dissension weaken our ranks. Let's not argue. Still was always going on about the arguments are in osteopathy, not outside of it. What we want to do with it. He says, don't let dissension weaken our ranks. Don't let jealousy open up the entering wedge of dismemberment. We shouldn't be jealous of other things. We're jealous of how medicine operates, how the power and the money that they have and the big venues that they have and the hospitals and the techniques for diagnosis. We shouldn't get jealous of it. We may be excluded from a lot of it, but we don't need it in many cases. You go to a hospital nowadays, and a personal experience of this with some of my patients and friends at home, they don't touch you. They never examine you. They don't even shake hands with you now when you go in. All they have is a test result. Many years ago in the Institute we had Dr. Dutton from the London College of Osteopathic Medicine. And he said in the early days when he was teaching, this is for doctors, and he said crude osteopathic treatment, early days doctors weren't too bad. Then he noticed some of them coming in with clipboards and wanting to know test results. He said by the end of the 70s, he literally had to go and say, here's your hand, place it on the patient. No, can't do that without test results. Can't touch them without test results. And that's a path we don't want to go along. And it's a danger. But Littlejohn says, his individual viewpoint of osteopathic principle application must be different from other people's, from when he's talking on this. But this principle that we have that governs our approach to health and disease, the principle, it's an abiding truth, and we don't understand the full depth of it yet. We can never understand the full depth of it until we apply it. And unfortunately, what happens with osteopaths, they come along, they develop it, they get older, they die, and their technique and stuff drifts away with them. And that's what the Institute was born out of, to try and keep that, that comprehensiveness of our approach alive. And again, there's another one he says, personally, I've ever been loyal to osteopathy, his principle of which as an abiding truth, the comprehensiveness of which we have not yet begun to realize. Why would he start off with saying, he's always been loyal to it? Because in the beginning we had all of this argument. The first argument in osteopathy started with the first school, when Ward went off and founded bonopathy, and then we have Davis coming along and going off and first of all drifting into chiropractic to learn the direct thrust technique, and then off into something else to find spondylotherapy and naturopathy. And people taking these things and taking them as wanting to get something out of it for themselves rather than taking the principle of osteopathy on board. And it's this principle, the first principle in osteopathy. It's adjustment. That's what Littlejohn called it. Adjustment. And out of adjustment, we have the background to that we are an articulatory mechanism. It's not just pure physics, it's physiological physics going through it. We articulate the body. We treat the body as a whole. All these words now are becoming popular. But if you look at the depth of what happens when people use them, the depth isn't there. And what depth do we need? We need that depth of physiology and anatomy that Hendrik was going on, and how to apply it in our treatment and with our patients. And he talks here about the central fact of life is motivity. No life without movement. And what do we do with our patients? We move them, we articulate them. And that articulatory field, Wernham always reminded us when we were students that the whole principle of articulation wasn't just bony articulation, wasn't just body articulation. We work right down to what Littlejohn called the dendritic field and beyond. That's where the articulation takes place. That's where the fluid exchange takes place in the nerves. That's where the health of the body comes from. Right down to that level. And it's based on vibratility. And he started to explain this from his own point of view, and I thought this was very important. That he said, I don't care whether a man is a believer in the superhuman or whether he's not. It doesn't make a bit of difference. The one who believes can't object to it, the one who doesn't can't object to it. That we have a higher being, a higher force in the body which governs it, and that's what we call, for want of a better word, the vital force. And it integrates the body with the environment and with how you use the body to give you the best health it can. That's its job. Not to give you health as such, to give you the best health it can, given how you're using it, what the environment is like, what you're putting into it, and all the old injuries that you have. And that's where osteopathy comes in, to try and give it the environment that that health can be the best that person can have. And he talks about the objective mind, gives us the manifestations of life, all the intelligence and the willpower that we have in the body is a result of it. And it's this, what he calls the nexus of the spirit and the body. And that wonderful chart that we found that I think it was, I can't remember who it was that drew it in first, back in Chicago in about 1902, 1903 from Littlejohn's lectures about the healing fields. And he starts off the nexus of mind and body, and then how it divides into the different nervous systems. And the two great nervous systems that we have, the cerebrospinal and the sympathetic, and how they have to be integrated. And that the sympathetic nervous system is cruder in vibratility but higher in rhythmicity, and the cerebrospinal, which is finer in vibratility but lower in rhythmicity. And when we think of it, we take that into the modern day when we talk, when we've got the Sutherland technique and the biodynamics and so on, talking about the long rhythms in the body. They're all the cerebrospinal ones which Littlejohn was talking about. Long rhythms, higher in frequency, lower in rhythmicity. And they're very fine rhythms that we have to balance within the body. As I said, he calls it the vital force, because that's what we have to deal with. We have to let ourselves be interviewed by it. And I always think that's a very good way of putting it. And Wernham used to that we don't just approach the body and do something to it. We have to be interviewed by that vital force. How are we going to help it or interfere with it? And some of the hardest treatments to give to patients are when they have had, I hate to use the word, bad treatment, rough treatment. And the vital force has had to deal with that. And now we have to come along and say, well, actually, you don't have to manage that. There's a better way of doing it. And it's the same way of when you... Oh, bless you. That's a good exit. A healthy reaction, a good sneeze. I'm not have to remember what I was saying.
Would you like a tissue?
Anyway, that you have to be interviewed by, so you're not actually imposing yourself, even though you have to impose a rhythm on the body where there is no rhythm. It's not the same as dictating to the body at all. And when we come to the body adjustment and how we apply that, it's a routine. And routine is a way of honing your skills and learning to feel and know the differences. As Still used to say, get to know the normal and then the abnormal will hit you in the face. Well, he didn't quite say it like that, but I mean, the same meaning behind it. When you know what is normal, you'll know how to treat. And this is why we have a routine. And the argument about the general treatment and using it and not, and it being a engine wiping and so on, goes way back in osteopathy. And I don't know whether it's still there or not, but they used to blame Littlejohn for it, and he was the one that introduced the general treatment, and that's what Still was complaining about and wanted out of the place. And yet, if you go back and read your history, he was talking about that before Littlejohn even came to Kirksville. He was complaining about it before Littlejohn came to Kirksville. The general treatment as such was taught there before Littlejohn came to Kirksville. And who was teaching it? Hildreth, Charlie Still, Harry Still. And what were they using it for? As a very simple means of trying to get people to learn how to palpate. But it all was going wrong because there was no format behind it. What did Littlejohn do? As an educationalist, he tried to put a form on it. He tried to put meaning on it. He taught there's a general treatment for nutritional effect. There's a specific general treatment for vasomotor effect. There's a specific one for, and so on. So he tried to put a form on it, and that form has come down through us through Littlejohn to Wernham, who's honed it even more. And why do we start on the right-hand side? As Wernham used to say, it's the compensatory side, so it's the easiest side. But it's also the cerebrospinal side. That right SI reflects the cerebrospinal force. So it gives you a way of entering and seeing what do we have to deal with this patient in terms of their will and how they're using the body, that emotional side that Hendrik mentioned. And we have to get that out of the way to allow us to work with the vital force, give the body back to itself. So it's a starting point. The left side reflects the sympathetic side, but it's a starting point. No,
Can I ask a question?
maybe.
Yeah,
Can you-
the cerebrospinal force.
Hmm?
Are you talking about cerebrospinal nerve system? Are you talking about the peripheral nervous system or vagus nerve?
Well, your starting point is the division of the nervous system, if you like, into two, those two great forces and how they fly over the body. So then it becomes quite complicated when you get down into the individual nerves. The vagus nerve is the primary pathway of the emotional side and the will, conscious, unconscious will, into the viscera, into the sympathetic. The trigeminal nerve, on the other hand, picks up all the sympathetic irritation within the body and integrates it with the cerebrospinal side. So it's a...
So the cerebrospinal side, is that the peripheral nervous
No.
system?
No. It's a bit more complicated than that. Cerebrospinal is about your conscious, unconscious interference with the body, if I can use that word, interference in a, yeah? Yeah. Whereas the sympathetic is about the visceral control of the body. Yeah. Littlejohn, again, I know I'm rambling a bit on this, but hopefully there's a point in it. Up in the cervical cortex, we have cells that we call the caudate cells. These caudate cells are the generators of every nerve fiber that comes out into the body. These cells are also the generations of every nerve impulse. Yeah. And the caudate body, which follows the line of the lateral ventricles all the way around and then ends up with the amygdala at the end of it, it's a very important structure, and it lives and breathes with the movement of the ventricles and the movement of the brain itself. And it's only in modern times that they're talking about the caudate cells being adult neurogenic centers in the body. So they're catching up all the time with where Littlejohn and Still came from. And ask yourself the question, why does that happen? As Hendrik was saying before, why are they trying to catch up now? And the reason is this so-called scientific approach that is being used. And I call it so-called because it's not scientific. If you look at any of the procedures that are held up as gold standard, what's the first thing that's missing in all of them? First thing is the assumptions. The assumptions that are there are never mentioned. The principle that's underlying it is never mentioned. And that's where osteopathy starts, with a first principle. The body is self-governing up to a point. We can interfere with it. It can be overwhelmed by toxicity in the environment. But that's our principle. It's principle of adjustment of the body back to itself and to the environment and to the cerebrospinal, the conscious, unconscious side within it. If you leave that out, you take a double-blind placebo test. What are you testing? Okay, test this drug or this procedure to see does it reduce the temperature. But why is that temperature there? That's not asked. Is it a good thing to reduce the temperature? That's not asked. Yeah. And that's what I mean about this so-called scientific approach, because you have to have the principle behind it. And there's one, we say a little bit later on, that we have this idea of action and reaction. Why stop at 6 treatments? Why was that a cut-off point, magical cut-off point, or 3 treatments, when the symptoms go down and you get this wonderful, sometimes wonderful physiological euphoria in the body, where the vital force is saying, thank God somebody is actually listening to me. And the symptoms go down a bit, and the patient feels wonderful. Stop at that point, it's wonderful. Yeah. But all you've done is, you've got a child locked in a cupboard that's screaming for help, all you've said is, okay, I'm here. You haven't opened the door, even at that point. You keep going, you get a reaction. The body's method of healing is inflammation. And what's the first thing we do with inflammation? Take anti-inflammatories. Here. Again, coming back to the principle. We must have inflammation. Inflammation means reaction. It means symptoms of some sort. And we follow the symptomatology, but we don't chase the symptoms. Yeah. Oh. So coming back to what I want to talk about, this idea of fragmentation and of how we divide osteopathy up and we start fighting amongst ourselves. And so what was Still's vision of osteopathy? I've mentioned it a bit there, that his vision was as a healthcare system. And the piece I've taken is from Will Potter in the Journal of Osteopathy in 1897. And he graduated in the first class or the second class in 1895. And this was written before Littlejohn came to Kirksville. And that's important because of the first sentence in it. That he says, with the exception of antiseptics and antidotes for poisons, the new school of practice totally discards medicine in the treatment of disease and adopts in their stead a system of intelligent manual operation by which the inherent recuperative forces of the body are controlled and directed to restore the harmony and health. Harmony and health. And it's because Littlejohn was often accused of mixing, because he introduced and said we do use antiseptics and we do use antidotes. And yet here we are from one of Still's first students saying that this is what the new school was built on. You have to have good hygiene. You have to have all of these things. Not what do you call separate things from osteopathy, but they're universal. Even Hildreth in his day acknowledged these things were important. And one of the arguments that was going on at the time, you even see that a caustic remark directed towards Hildreth, saying that even Hildreth says that an enema is useful at times. So let's not argue amongst ourselves and stick to this principle of osteopathy. So I said we need to have all the branches that the osteopath requires, special training in the development of the most delicate sense of touch and a knowledge of the special nerve centres unknown to other schools. They're beginning to talk about them, the reflexes and so on, somatovisceral and viscosomatral and so on, and change the term osteopathic lesion to somatic dysfunction just to try and get on with other people. But we need to have that special touch, and that takes time. And that's what Todd was talking about yesterday in his talk, how to develop that, how to listen. As an old friend of mine just said once, if you're talking, you can't listen. You can't listen. And in treatment, if you're doing something to the body, you're not listening. And you have to listen in every movement that you do. Every movement introduces a new feedback to you, and you react to that and you feed something back in, and you're listening in this conversation or this dance the whole time. And it's never the same. So Wernham used to emphasize that with the body adjustment. It looks the same, it's got an unvarying routine, if you like, but it's never the same twice. The pressure is different, the angle, slight difference in angle, slight difference in pressure, slight difference in the fulcrum that you're using. And he likened it to if you're sitting down watching a sculptor with a hammer and chisel. All he's got is one hammer and one chisel. And yet, slight difference in the angle of the movement, slight difference in the power of the hammer gets a totally different result. And that's what it means by not being the same twice. And we differ from other schools. Or as the point before that says, it's a complete system of treating diseases and deformities without drugs or appliances. And unfortunately, we don't get the rein to do that and to prove it. Because you can't take a patient who chooses one and a patient who chooses another and follow them through their life to see what happens. And that's where we come back to principles. The wrong principle applied in the wrong place, you get the wrong result. You go back to the beginning of vaccinations, and you see that very clearly with the Lincoln experiment, as they call it nowadays, where in Lincoln they decided not to go. They'd had enough of the vaccinations back in the 1700 and something, I can't remember the date, and they had much better health and outcome than those that were forced to have it. The principle. What are we doing? What do we want to do with the body? Where do we look? How do we define health even in the person? But I say we differ from other schools of medicine in the remedial agents applied. We use only our hands to do the work. It differs from massage and other so-called manual therapeutics in that no osteopathic diagnosis or treatment is possible without a most exact and practical knowledge of all the parts and processes of the physiological and pathological man, or the anatomy and physiology. It's critical, our knowledge of that. The problem with physiology, as Still used to say, 9/10 of it is bunkum. I think that was the word he used. It's theory. The latest theory is. You look up at anything, our latest theory is. Like take the cell membrane. the bilipid cell membrane. You read in modern physiology book, what does it say about it? The currently most accepted theory is, and that's what it is. So it has to be interpreted, and it's our interpretation of those things which is important. And we only interpret those with our principles. And this is what Littlejohn did. If you read his psychophysiology or his physiology, he interpreted the physiology. Still famously came in and drew a picture on the board, squiggly lines, said, "What do you think of my pig?" You know, and the students all didn't want to offend him. They said, "Oh, it's brilliant, it's this and that and the other." What was his point? His point was, don't just accept what somebody says. Prove it up for yourself. And he's trying to get that point across to him. Just because I've drawn a squiggly line and called it a pig doesn't mean it is a pig. You know? And it's the same with anything that's so-called scientific or whatever. Don't accept it just because it says it is. As Henrik pointed out time and time again, how the modern physiology is just catching up with osteopathic principles. The principle of looking at the body. That must be lymphatic because that's the only way it could work osteopathically. And central to this is another old osteopath that was published he graduated in 1899, Evans, which means he was under the influence of Littlejohn in the school. And there was this old debate back in the early 1900s, are you a lesion osteopath or not? And there's a number of people that Littlejohn said there's no such thing as a non-lesion osteopath. But let's see what Evans had to say about it. The belief in osteopathic lesion as the causative factor in disease and its removal as the effective measure in bringing about a cure constitutes one an osteopath. That's what makes you an osteopath. That principle of understanding what this term osteopathic lesion is. And I know of no better term for it than osteopathic lesion, because it's all-encompassing. Doesn't restrict you. And if one does not hold to this, he's not an osteopath. Doesn't matter what his professional relations may be. And the reason he's writing this at the time was to heal division. Same as what I started with, of Littlejohn saying, don't let dissension and disagreement and injection split up the osteopathic world. And yet we do that all the time. And there was a big debate at the time, we want to go, well, let's change the name, let's get rid of this, and then we can get in with the medical schools and so on, because they don't understand the term, so they don't want it. Why change what we do to please somebody else and let our own principles go? It says, men and women differ in opinion, so it's natural that we should look at matters relating to science from different points of view. The same thing what Littlejohn was saying. There are radical, clear-cut minds amongst us who believe to remove the lesion, giving attention to it solely in treatment, is all the aid that nature requires. Yeah, that's one way of doing it, he says. The specific treatment only, and just leave it at that. Sorry, did I skip something? Yep. There are others who believe, perhaps, no less effectively, with no less in the effectiveness of the removal lesion, but hold that other palliative manipulation is helpful. He's trying to heal the wounds that are there and get people to say, well, if you believe in an osteopath, okay, you're doing it one way in the lesion. I'm doing it another way. You know, I believe my way is better than your way, so I'm not going to talk to you. I'm not going to learn from you. You know, go away. You know, we shouldn't let those dissensions. But the point behind it is, if we have to let go of our principle behind that, you know, then that's something different. We have to stick to that principle of adjustment being it's not bony adjustment, it's body adjustment is the principle of osteopathy. You know, it is the principle of articulation that we need in that to achieve that, and it's the balance between the arbitrator being the vital force in what we do and what we apply, and has to be taken and changed into the physiological equivalent rather than just a physical treatment. But he put it very bluntly at the end of it. He said, but to feel, to believe with all one's heart and mind and strength that the osteopathic lesion is the essential and distinctive feature of the osteopathic system is to feel in what constitutes one an osteopath. And over the last century, what have we done? Abandoned the term completely. We'll abandon osteopathy completely. I mean, I don't think we are all under the banner of what health sciences together, and we're all trying to do the same thing. But you have to ask, are we? If there's no principle at it, then we're not doing the same thing. If we haven't decided, is a childhood illness a danger, or is that an illness which children have to relieve toxic matter that they have accumulated through generations beforehand? Littlejohn said it's not just the toxic matter in the person from that they've accumulated, but it's from their parents, their grandparents, and so on back that has to be dealt with. And the body has to have a method of dealing with that. So we suppress all of those things. What happens? You look at the explosion in ADHD and Asperger's and all of the rest of these things and autoimmune things. Where has that come from? This brings us back to our principles and our interpretation of the basic sciences. So, Wernham's vision. He talked about this artistic side, and it was always called the art of medicine. Art precedes science all the time. You go to a stonemason building in Chartres Cathedral. He knew how to cut the stone with a hammer. He knew how to face it properly so that there wasn't damp on the inside, and so on. He knew that from experience. The art was there. The science comes and explains the art afterwards, not beforehand. And this battle between the two that's always there, and it's in every one of us when we treat a patient. The art of the movement, the art of doing, and then the scientific side behind it that we have to know, that Hendrik was talking about so elegantly. We have to know all of that. We can't just pull it out of the air. This whole thing of intuition. Intuition means direct perception without going through the cognitive process of information that's already there, not something magically from somewhere else. And Werner goes on about this art and science, it also leads into this battle between the general and the particular. Littlejohn would have none of the treatment of going and doing specific high velocity thrust or whatever and leaving it to nature to sort it out. You've got to prepare the field for the adjustment, which can take quite a bit of time. Still, has been said about him, it takes 6 months to prepare for an adjustment. 6 months of seeing a patient maybe 2 to 3 times a week to get the pelvis to move. Go and read Graffitt's papers and various other ones about the time. We too often hear one treatment here and he was cured, or they've been to everyone else and they came to Wernham and he did one treatment and so on, he was cured, or somebody else. None of those osteopaths would say that that is the way it works. Still, in Graffitt's papers, Graffitt was told when he came to Still first, Still said to him, don't expect any real change for 6 months. And he had to deal with all sorts of reactions during that time. I mean, boils under his arm and skin eruptions and everything else. So, reaction means the body is heading in the right direction, and we have a means of interpreting between a health crisis, healing crisis, and a disease crisis where it's going the wrong way. And that comes back to rhythm and the general rhythm in the sympathetic side and in the cerebrospinal side. If that's improving, you're heading towards a healing crisis. But a healing crisis doesn't always mean living. I had a child of 10 who had drowned in Spain on holidays, and he was unconscious. His brain was very, very badly damaged from the lack of oxygen, and I was treating him. And in this 3rd or 4th week of treating him in hospital, the general rhythm was improving so beautifully. I was wondering, that tells me this is heading towards a healing crisis, but I know this brain is not coming back. You know? And I had to say something to the parents about it and explained I wasn't sure what this meant, but this is what I was feeling, and that I didn't think the child was going to come back. The child passed away that night, which was beautiful. Parents wrote me a beautiful letter saying how I had helped him complete the process of dying. And sometimes that's what we have to do. Unfortunately, if you haven't got a medical degree after you and the patient dies, you're accused of killing the patient. If you've got a medical degree after, you can, oh, well, I followed the best practice procedure, therefore I'm safe. You know, might have killed the patient, but you're safe. You know. So I think I'm running out of time. It's about Warren. I'm talking about what I was talking about by action and reaction, and the reaction in treatment, that you get that physiological euphoria, then you get a crash. You keep on going, you get another, not quite as much physiological euphoria, then another crash, not as much. You usually get 2, maybe 3, maybe 4 crashes along the way. And that process can take, as I say, quite a long time. You know, if I go back to my own eye, why did I lose the sight of it? I was not exactly in the best health of my life going to Warnham and starting to study osteopathy, which is one of the reasons why I started. Treatment in the beginning felt beautiful. I came out of the first, oh God, I could walk up that hill, I could run up the hill up to Tunbridge Road, if you know it, after the treatment, which I couldn't do beforehand. Physiological euphoria had to be a reaction, yeah. And that reaction came out at that time in my eye. And I was lucky that I had Warnham as an osteopath who understood it, knew what it was, and took it on to treat it, rather than, I did actually go to he did ask me to go to the hospital in Maidstone, which was a very good eye hospital, to find out what was wrong, just in case there was a splinter in it or something that I didn't know about. And they gave me the diagnosis, good medical diagnosis, corneal epithelial dystrophy. Lovely term, never forget it. A little bit of a recurrence later on in life when I moved back to Dublin, so I thought I'd better get it checked out again. No sign of scarring on the cornea whatsoever. And the fellow that was looking, I said, you mustn't have had corneal epithelial dystrophy because there would be scarring. You know, no convincing him of otherwise. You know, but I didn't make that term up. But just to finish up on just this one point here, but Warren was making, he was talking about cranial technique, and he used to always quote Littlejohn, because people start working on cranial work and they sit there for hours and they only work on the head, or they work, he came out from one place, they do a bit in the head, bit in the sacrum, and just for completeness they touch the diaphragm in the middle. There's no integration. And he said that we must learn to deal with our cranial problems in closer union with the body adjustment than has been the case in recent years. So he was talking about, this is the way to go. Let's talk. Let's not have disagreements, not have arguments. Let's talk openly about it and integrate and go back to our principles. But don't ever let go of those principles. They're our lifeline. They're what keeps us as osteopaths and stops us from being integrated into other schools. And I've just one other point, if I can find it. Now, this is what happens when you don't know your physiology. This is Littlejohn was talking about a case report where an old osteopath, Ferdy, had a case of fatal diphtheria, and he said, while writing about it, well, I don't believe in the efficacy. This is not Littlejohn talking, he's quoting this other osteopath, Ferdy. And I don't believe in the efficacy of the serum treatment, yet In spite of osteopathic treatment properly given, combined with swabbing the throat and proctor and all these other things, the disease continues to increase in severity. I think I should realise the hopelessness of the case under such treatment and would administer the antitoxin as a last resort. So he's let go of his principle. What would happen if that patient was under the antitoxin? He'd have probably died earlier, and maybe more horribly than under osteopathy, if a treatment was given properly. If you don't know how to do the treatment, if it's not working for you, consult another osteopath who may give you a little more insight into it. And the sad thing, I go for osteopathic treatment, my wife goes for osteopathic treatment. Why? Because they feel it is the best they can do for their health. They look after the diet, they have all the other things that we need to do in good hygiene, but it's the best you can do for your health. So one other little tiny evidence-based. I knew I had too much in this. Come on. Okay. If osteopathy is to be established as a theory and practice, if its principles are to be demonstrated, and if the profession is to be perpetuated, these ends must be promoted through schools or colleges devoted to osteopathic research, education, and clinical demonstration. And as osteopaths face the problem of its own continued existence, this was back in 1910, Littlejohn was saying that, even then it was faced with death, osteopathy, from the Flexner report and other things, and the process of, let's integrate it, let's all be in health services together, and then suddenly there's no osteopathy. The most fundamental problem of all is in relation to the colleges. The profession depends on these educational institutes for recruits in its ranks. Nope, I didn't find it. That's what we don't do. I'll end there. Okay, thank you for your attention. I hope that wasn't too rambling.